On February 13th, Dr. Robert Redfield, the director of the US Centers for Disease Control and Prevention, warned that the virus can be spread by people who are asymptomatic. In other words, you may be sick, but won't know it because you don't have any symptoms. But at the same time, the CDC was recommending that you should only wear a mask if you have been exposed or are showing symptoms. But if you're asymptomatic, you don't know that you're sick, right? So it would make sense to suggest that you wear something over your face, just in case. But that would be common sense, and unfortunately, public health officials don't seem to have a lot of it. Thanks to the health crisis, when most people hear the word mask, one of three types may come to mind. The first would be a medical or surgical mask, like the one my Animal Crossing character wears. And no, you can't visit my island. Please stop asking. These masks are generally used to prevent healthcare professionals from transmitting particles from their nose and mouth to their patients. The second type would be an N95 respirator, which protects the wearer by filtering out particles. And the third would be this.
No one cared who I was till I put on the mask.
Now, at this point, it's nearly impossible to find these anywhere to purchase, with the exception of the Bane mask. But even if you can find them, or just happen to have some lying around, public health officials have been very much against the general public wearing these masks. On March 2nd, the United States Surgeon General Dr. Jerome Adams appeared on Fox News and had this to say about it.
Doctor, you're saying stop using masks because unless you've got the coronavirus, you shouldn't be wearing it, right?
Absolutely.
You hear that? If you have a mask, you need to stop wearing it. Wait, what?
And one of the things they shouldn't be doing, the general public, is going out and buying masks. It actually does not help. It's not been proven to be effective in preventing spread of coronavirus amongst the general public.
But at the same time, it hadn't been disproven. Remember that when Dr. Adams made this statement, there were only 75 known cases in the United States, so the data wasn't there because it wasn't being collected.
What the World Health Organization and the CDC have reaffirmed in the last few days is that they do not recommend the general public wear masks.
Oh, the World Health Organization said not to wear a mask? You mean the World Health Organization, who ignored warnings from Taiwan back in December that there were signs of human-to-human transmission? The same World Health Organization who trusted claims by Chinese authorities that there was no evidence of human-to-human transmission? The World Health Organization that advised against travel restrictions and saying that during a public health emergency that it would be ineffective? The World Health Organization who waited until this thing spread to 114 countries to announce a pandemic and then had the balls to say this?
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
So if the WHO tells me not to wear a mask, I'm wearing a f***ing mask. So Dr. Adams goes on to explain exactly why the general public shouldn't wear masks.
Here's why. On an individual level, there was a study in 2015 looking at medical students. And medical students wearing surgical masks touch their face on average 23 times. We know a major way that you can get respiratory diseases is by touching a surface and then touching your face.
Then the solution is don't touch your face.
So wearing a mask improperly can actually increase your risk of getting disease.
I don't see how wearing a mask improperly is going to put you in more danger compared to not wearing one at all. I mean, it's going to give you some protection, right? People wear bike helmets wrong all the time, so should we tell everyone not to wear bike helmets anymore? Of course not. As it turns out, Dr. Adams is basically parroting the WHO.
But there is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly or fitting it properly or taking it off and all the other risks that are otherwise associated with that.
So let me get this straight. If you're a healthcare worker, a mask is a benefit. If you're a normie, they're a dangerous hazard. Yeah, sure. Maybe instead of the World Health Organization and the Surgeon General telling you not to wear masks because you're doing it wrong, maybe they should give guidance on how to wear them properly and how to remove them properly.
On a population level, It's important for people to know that we tell sick people to wear masks so that you don't transmit disease to others.
And that's well and good, except on the day that Dr. Adams was saying this, the CDC director told NPR that the amount of people that are infected but show no symptoms may be as high as 25%. So that means that if you're out in public, you should probably be wearing a mask because you could be sick, not know it, and transmit the virus to someone else. And with that, on April 3rd, President Trump announced a new voluntary guideline.
The CDC is recommending that Americans wear a basic cloth or fabric mask that can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks.
In response, the CDC released a tutorial showing how to make your own face covering from the guy who doesn't believe that you should be covering your face. You can't make this stuff up, folks.
Here's how you can make your own face covering in a few easy steps with items you can find around the house, like an old scarf, a bandana or a hand towel, or you can make a face covering out of an old t-shirt. Fold it to the middle from the bottom, fold it to the middle from the top, fold it again to the middle from the bottom, and again from the top. 2 rubber bands, one on one side and one on the other side. Then you fold either side to the middle, and you have yourself cloth face covering. It's that easy.
If it was that easy, why wasn't this suggested weeks ago? Well, the Surgeon General explains.
Well, what's changed is we found that there are a significant number of people who have asymptomatic spread of the virus. And so the CDC changed its recommendations today, and they now suggest that the general public consider wearing masks when they're going out in public so as not to spread disease to other people.
But the CDC knew that there were asymptomatic cases back in February. The only difference a month later was that there were more of them. And you can blame the rise in cases, at least partially, on the fact that people were transmitting it easier because they weren't covering their faces. And by not suggesting that everyone cover their face in public as an extra precaution, and even worse, specifically telling people not to wear masks, this helped lead to shutting down the entire United States economy. Great job. And don't get me started on the state level. Take, for example, New York's Commissioner of Health, Dr. Howard Zucker. Days after the CDC warned that 1 in 4 people can be infected and not know it, Dr. Zucker still was not recommending face masks.
There's no data to support the effectiveness of face masks, and I understand that usually we like to have base things on evidence.
First, if you want to see data on mask effectiveness, you have to tell everyone to wear masks when they go out in public, wait a hot minute, and then see if there is a drop in cases or not. You're not going to see data on mask effectiveness if you're telling everyone not to wear masks. Then again, maybe we should wait a few years until we do a proper control experiment. We have nothing but time.
There isn't data to suggest whether masks, except for those who are ill and those who are healthcare workers.
But you don't need to reserve anything here. Just tell the general public to make their own mask for now. Virginia Tech engineering professor Lindsay Marr, who studies virus transmission, told NBC News 4 in Washington that she advises that if you're going to make your own mask, that the material be thick and densely woven, like a kitchen towel or heavyweight t-shirt. And the mask should fit tightly around the nose and mouth with no gaps. And that makes sense because a thick kitchen towel like this is probably better to use than a cheap promo towel from a sporting event. I can literally see right through this thing. Wouldn't it be nice if public health officials shared this kind of useful information? At the very least, they should have the attitude that Governor Cuomo has about it.
Might it help? I think it's fair to say yes, but don't get a false sense of security that now you don't have to social distance and you don't have to take the normal precautions because you're wearing a bandana. I think it's fair to say the masks couldn't hurt.
And that's exactly right. Wearing a mask or face covering isn't dangerous. Just be sure to wear it correctly, continue practicing social distancing, wash your hands, and stop touching your damn face.
It's that easy.
Thanks for watching, sharing, and hitting that like button. Follow me on Twitter, and if you haven't already, subscribe to the channel. Check out the links in the description and check out these videos that you may have missed. As always, thanks for stopping by, stay safe, and I hope to see you next time.